Hey nurses, looking for exclusive discounts? Nurse.org has you covered with deals on everything. Save big on the essentials you need to excel in your career. Don't miss out. Visit nurse.org/discounts for the latest discounts made just for you. You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Welcome to the Nurse Converse Podcast. My name is Colton Lord, and today we are so thrilled to kick off a very special series that's been weeks in the making, a 5-part journey through the world of nursing innovation recorded live at the Health Conference, the biggest healthcare innovation event of the year. The healthcare landscape is rapidly evolving, and more than ever, nurses are leading the way with groundbreaking ideas that are transforming patient care, safety, and our entire approach to health. In each episode, we'll dive deep into the stories of 5 extraordinary nurse innovators who have shared their insights, inventions, and expertise with us right here at the conference. These nurses are not just responding to the needs of healthcare, they're reshaping its future. Whether you're a healthcare professional, aspiring innovator, or just someone passionate about the future of medicine, this series will give you a front row seat to the challenges, successes, and journeys behind each innovation. So join us as we step into the world of nurse innovation and meet the minds shaping the next era of healthcare. Now let's get started with episode 1. To kick off our special series, we couldn't have asked for a more inspiring first guest. Today, we're honored to welcome Dr. Bonnie Clipper, a true pioneer in healthcare innovation and a driving force for the future of nursing. Bonnie has a remarkable career spanning over 2 decades as a chief nurse executive, where she not only led, but truly transformed patient care. But her accomplishments didn't stop there. She went on to become the very first vice president of innovation at the American Nurses Association, shaping new paths for nurses in leadership and innovation. As a nurse, futurist, global speaker, and one of the most influential voices in healthcare today, Bonnie has her finger on the pulse of what's next for the profession. She's also a podcast host herself, reaching audiences around the world with insights on healthcare trends, leadership, and what it takes to innovate in such a dynamic field. In today's conversation, Bonnie shares her journey, her vision for the future of nursing, and her advice for nurses looking to break boundaries in healthcare innovation. We're so excited to dive into her story and hear what she has to say about where nursing is headed next. So without further ado, here's Bonnie Clipper. All right, Bonnie, thank you so much for being here today on the Nurse Converse Podcast. Kind of give us a background on how you got into nursing to start off with.
Yeah, that's a great question. I knew as a little kid that I wanted to be a nurse. So I have wanted to do this for a very, very long time. In fact, on my laptop, I have a picture of me being 6 years old in my jammies with my little nurse cap and my nurse bag and my stethoscope. And it was always a goal for me. So I knew I wanted to be part of this. I didn't at the time know exactly what that meant, but it was never really a question of going to nursing school, but rather, what do I do once I become a nurse?
Okay, so it was like a knowing that you had from a young age. I love that. So what inspired you to get into the entrepreneurial world, like the innovation world, and what challenge were you facing in your nursing career that inspired you to go down this route?
Yeah, that's a great question. So really, there's just so much opportunity in healthcare, and the space that I saw an opening in is that during the pandemic, having been a previous chief nursing officer myself for over 20 years, so many of my colleagues were really trying to figure out, how do you provide care in a very dynamic and kind of crazy world at the time of the pandemic? How do you actually provide care that is safe for nurses and for caregivers? So had, 50, 60, 70 conversations with CNOs around, hey, do you have any ideas? Are you seeing things work in different organizations? I had conversations with one CNO because her staff were going to the Goodwills and buying up all the baby monitors, since they already bought them from the Targets and the Walmarts, and putting them in patient rooms to observe patients. Had a CNO that actually had a director with this brilliant idea of putting GoPros on bike helmets on nurses so they could actually stream to providers what's going on with patients. So we've, passed and moved through the pandemic, and then really the issue is, how do we create a sustainable virtual care model that nurses can still provide care Now that the house isn't on fire, we have a little bit more of an opportunity to think about what that looks like. So it's good that we've resurrected some of the technology and improved on technology that exists to deliver virtual care and virtual nursing. The opening that I saw is really around, there is so much in terms of change management that just causes fatigue in the organizations and across the leaders. And no matter how expensive the technology is, if it isn't launched properly with good planning, good messaging, good buy-in, good design, development, input from the direct care staff, it isn't going to work. So that for me created an aha moment where I really wanted to decide, how could we offer some kind of a solution to help this thing called virtual nursing or virtual care? How could we make it easier and how could we make it stick? And that's when I created the Virtual Nursing Academy.
Enjoying this episode? We want to hear from you. Share your feedback and support your favorite host by completing a quick survey, and you'll be entered for a chance to win a $50 Amazon gift card. Head over to Nurse.org/podcast and let us know what you think.
Your company essentially is called Virtual Nursing Academy. So are you helping in healthcare systems to create they go through this course and that's how they learn your process to delivering like virtual nursing care? How exactly does a system take your roadmap and implement it?
Yeah, that's a really great question, Colton. So thank you for that. What we've been able to do is we've created hours, like 84 hours of content around this. And we have it broken into 6 modules. We have a nurse planner that works with us. So we've created objectives and outcomes. We can give 33.75 CEs. And we do this a variety of ways. People register with us, so they can either register as individuals, onesie twosies, or we have health systems and hospitals that register teams with us. So we've had teams of between 5, 10, 12, and 30 that register with us. Their whole team goes through the Virtual Nursing Academy at the same time. It's about a 8-week process. So what we do is we provide them access to our content. They go through all the content, and then we supplement that with live check-in sessions. And those are about 50% didactic and then 50% open discussion Q&A. And then we supplement that through an online community where people can drop in, ask questions. We'll give them answers, share articles, share literature. And then we also started offering organizational private coaching at the request of our clients who have said, hey, this is great. We're learning a lot. We're understanding use cases, how to build a business case, how to look at ROI, what kind of care model we want to adopt, how we might staff this. Are we going to pursue throughput issues, ED hold issues, improve safety, improve quality, whatever their use case is. And now we actually can offer them private coaching to supplement the group or that team alone. And that was a request from our clients who said, this is all awesome. We're learning so much, yet we want to spend time with you and your coaches as a private offline conversation. We don't want any other organizations to be part of that, but we have questions that we'd like to ask. That's when we also started supplementing with private group coaching sessions.
Wow. So innovative. It's the whole theme of this whole conference. And I love that. What have been some of the biggest hurdles that you've faced as an entrepreneur in this role with creating this Virtual Nursing Academy that you have faced, and how have you overcome those?
So essentially, just like every single product and service, we have to educate people on what it is we do and how we offer it and help them understand the benefit, right? So you can't just take a product to market without being extremely clear about what's the benefit. And part of that is introducing ourselves, the expertise that we bring. So I have a team of incredibly gifted virtual nurse leaders that do this with me. There's a core team of 5. We have probably about 10 virtual nurse coaches. So everyone has deep expertise, everything from care transformation, building care models, to hospital operations, to virtual nursing. So we're able to create kind of a wraparound support system so that the hospitals, health systems, and nurses, they learn from us how to actually leverage and amplify the technology that their hospital is spending $1 million on.
Yeah. Wow. So when you talk about this core 5, are these all nurses that you have on staff?
So of our core 5, a couple of us are nurses and a couple are business or operations people. Okay. And of our team of coaches, they're all nurses.
Wow. I think that's what what I've seen in this conference is it's so important to have the nurses directly from the bedside coming in to give their expertise and their outlook on it. And I think those are becoming the most successful businesses are the ones that are coming direct from the bedside to give their input on the challenges that are being faced in healthcare today. So kind of my last question to wrap this up with you, Bonnie, is what advice would you give to a nurse out there that's wanting to explore innovation or entrepreneurship for themselves? What advice would you give to them to step into this role?
I would say it's the perfect time to really learn how not only to innovate, but to transform healthcare. And the beautiful thing, and I say this tongue in cheek, is that healthcare is kind of messed up. So there's nothing you can do. There's nothing we can do, Colton, that's actually going to make it worse. We can only make it better. Yeah. So why not jump in now? Yeah. Why not start now? Why not learn as much as you can now? And even if you're not in the position to be an entrepreneur and start your own business, be an intrapreneur in your own organization. Offer your ideas, offer your solutions, and get involved to try to contribute to make things better.
Yeah, and maybe from there, just that jumping into it with everybody else, like maybe that's where you'll get your inspiration to eventually be an entrepreneur if that's like the route that you want to go, right?
Absolutely.
Yeah, that's amazing. Bonnie, thank you so much for sharing your expertise, your input. I was going through your LinkedIn and just everything about you, and you have such an impressive resume. I loved just kind of looking through everything that you've done, and I'm sure that there's many that I don't even know about. It's nurses like you that are changing the game for healthcare and inspiring the upcoming nurses and the future generation of nurses. So thank you so much for being here with us. We really appreciate you.
It's my pleasure. Thank you very much.
Of course. And that wraps up this special episode of our special Nurse Innovation series. We hope you enjoyed our conversation with Bonnie Clipper and were inspired by her vision and dedication to healthcare transformation. But we're just getting started. There is so much more to come. In the next episodes, we'll continue to dive into the world of nurse-led innovation with more incredible guests, each bringing their unique solutions and stories to the table. If you're loving the series so far and want to hear even more inspiring interviews, we'd love to hear from you. Please take a moment to fill out our listener survey at Nurse.org/podcast. Your feedback helps us shape future episodes so we can keep bringing you the insights and stories you care about most. Thanks for tuning in, and don't forget to subscribe so you won't miss what's coming next. Until then, keep pushing boundaries and redefining what's possible in healthcare. See you next time.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.